speaking out about how the new income tax relief package is expected to affect them. And as we hear from Krista Campbell, it's not expected to be good.
Noticeably absent from Wednesday's discussion forum on the government's new tax relief program at the University of the West Indies Mona campus, public sector union groups. But a few nurses were present and curious about how the change to the income tax threshold would impact them. Two of them TVJ News spoke to were not too pleased.
Nurses do overtime right now to ensure that we have enough staff to cover all the patients that we need to look after. That tells me if I'm earning $1.3 million and my overtime takes me over 1.5, then I'm working harder, but I'm going to be taking home less. When we ask for creative things such as housing and cars, so now we're saying, give us opportunity to own houses. But what we found out was that nurses who are at level 1 and 2 are unable to qualify for the maximum NHD benefits because our salary range is not at that cap.
Trade unionist Helene Davis White expressed similar concerns about the impact the new tax relief package will have on collective bargaining. It's thought that some workers may no longer lobby for better pay, as that would mean they will have to pay more income tax. She singled out the public sector, noting that recent wage negotiations revealed that 60% of all public sector workers in Jamaica are earning within the new tax threshold of below $1.5 million per year. The nurses say it's a situation that will further affect patient care in Jamaica's already aging health system.
A decrease in productivity in healthcare results in a decrease in the level of patient care because we have less nurses coming out because of that disincentive to do overtime. Then what happens to the nurse to patient ratio? You find that there are less nurses coming out because there is no incentive to come out because we're going to be getting less pay. So the patient care, we have less nurses caring for the same amount of patients, sometimes even more. So then you find that the quality of care may decrease. We have nurses at home now, despite the fact that we have to pay for our education, who are unemployed. So if you're not employing, I don't want to do overtime because I'm going to get less, then who's going to keep the health system together? And our concern is always about quality patient care.
They fear the new tax relief program will cause even more migration of local nurses, which is already a major concern. Earlier this month, President of the Nurses Association of Jamaica, Janet Kaur-Farr, appealed for government intervention to help stem the migration of specialist nurses from Jamaica. Krista Campbell, TVJ News.